It's Wednesday night, and we're live from Oakdale, Washington, in the Educated Touch studio. Welcome to Ethics Outside the Box, with your host, Nathan Nordstrom. Special guests include Susan Salvo and you. Here he is, Nathan Nordstrom.
So, hello everybody, it's great to see you and great to talk to you today. I am so excited about today because we have one of my favorite people, one of my special guests today who, you know, I have to say, Susan, I hadn't met you until I was plenty into my practice, and I connected and figured out that you were the author of a pathology book, and you were doing so much with teaching, and you were going through, and I just got excited because by the time I met you, I was on the national board for AMTA, and people had said Susan Salvo, and I was like, okay, I don't know who this person is. And then we met, and I'm like, oh, okay, you're the one they're talking about. And it's so exciting to see someone who has such a passion for the same thing that I have. And yes. So it's so nice to have you with me, Susan. Thank you. So, Susan, what's going on in your day? What types of things are you working for on a daily basis, and what's new and exciting in your life?
Oh my gosh, there's so many exciting things going on right now. Well, last year I finished my doctorate. It took me a long time, and I love research. And working on the 6th edition of my first book. My second book is in its 4th edition. And actually right now what I'm doing is I'm working on 2 research projects. One is a little bit more pressing than the other one. The first one is going to be the impact of empathy in education and distance learning. And I'm doing that with our local university. And then I'm doing another project on career longevity among massage therapists, and that'll be probably 2019. So, but I'm just very excited, and I'm loving hanging out with you, and I love the time we spent together in Washington. And in fact, the first time I meant to meet you, I love the story about us, is because you were teaching ethics when I was teaching pharmacology in Washington State in Yakima. Do you remember that?
That was quite a few years ago. Yeah, Yakima.
And every time I looked for you, you were gone. I would look for you in your room, you were gone. Look for you in the lunchroom, you were gone. And so you were like this phantom man. And I didn't meet you until years later.
Well, yeah, Yakima was great, except for it's in the middle of Washington where nothing else is.
No.
So you really have to fly in and then drive for a long time. But yeah, that's right. Yeah, that was I think probably the first time I heard about you teaching pathology, and I was like, wait, she's known for pathology. And so yeah, that was quite a while. But thank you so much for coming and visiting with me and kind of connecting with me today. This has kind of been my year's passion, just kind of pulling ethics together and really connecting people with the values of connecting with their ethical roots and the things that they have committed to already as a massage therapist. And so this is kind of the pushing through. We're now into October, and we have October, November, December, and I'm so blown away by what the ethics and standards say and how black and white they really are. And so before we go any further, Susan, what I want to do is I want to introduce the subject that we're going to be talking about today generally, but I know we've got other things that we're going to shadow off on because, gosh, whenever we talk, we tend to grab about 14 other topics as well. So let me see if this goes to the right page. Miss Susan, are you seeing the National Certification Board's website there?
No, I am not.
Okay, then I'm going to stop sharing that, and I'm going to start sharing the right thing. Here it is. Now you should probably see
yes.
a blue screen. Perfect. All right. So for those who don't know, if you haven't been playing with us, the National Certification Board of Therapeutic Massage and Body Workers has a new website. They've had that up this year, and it's looking really nice with new pictures and new pieces. The thing that I always tell people is if you haven't been on the NCB's website, go and start pressing buttons and start figuring out what goes to where. Most people that I know who are looking for something usually want to go to this find button and go to find a CE provider, find a school, or find a certified massage therapist. Those are the three under the find. So those are kind of ones that are kind of important for people to be connected with. However, for the purposes of this conversation, I always go right down to the bottom and I go to the About section, and we're going to go to, initially this year we started with the About the Code of Ethics. However, we got through that fairly quickly, and so we've moved on to the Standards of Practice for the National Certification Board. So we're going to click there, and we have moved through the first three standards of practice. So the first one was professionalism. Section 2 was legal and ethical requirements. Section 3 was fairly quick, and confidentiality, which that's a huge discussion, even though it's only, what, 1, 2, 3, 4, only A through E. But now we're on 4, and this is kind of a lot of the nitty-gritty stuff in my mind. This is stuff that your grandmother, your mother taught you. Be honest, be truthful. Don't pick your nose in public. Wait a second, that one's not on here. So we are now on F and G. So for F and G. So I'm going to read for F first. So actually, let me get it a little bit bigger so we can see it better. And if I recall correctly, I gave you a little bit of heads up, Susan, on what we're going to be talking about for 4F. Is that correct?
That's correct.
Okay, sure. Okay, so 4F is promote his or her business with integrity and avoid potential and actual conflict of interest. Oh my gosh, I love this one, but I always like to give you the chance to start. So conflict of interest, what are some things that you see or some concerns that you have with conflict of interest?
Well, first of all, we have to define conflict of interest, and actually have a definition right here.
Uh-huh.
And it comes from the National Institute of Medicine, and it says that that conflicts of interest are any financial or other interest that could impair objectivity. Now, the key word is that it could impair, because even if a conflict of interest does not actually interfere with judgment, it is still considered a conflict of interest and still has to be disclosed. So I think that's a real important distinction to make, Nathan.
I absolutely agree. And I know it's funny, whenever I'm going out and teaching, I don't believe that my work is a conflict of interest, but I know that other people might. And so people know that I work for Hand and Stone Franchise Corporation. And so when I come out to teach, I have, in my own heart, for myself, I say, you know what? I need you to know that this is who I represent in other ways. So I'm on the National Certification Board of Directors. I work for Hand and Stone Franchise Company. And I teach continuing education so that everyone knows who I am, so that it's not just me and my idea of, is this a conflict of interest? But I want to make sure that everyone else feels comfortable knowing where I'm at, so that if there's a perceived conflict of interest, it's at least put out there in the forefront so that we can talk with everyone on the same page with knowledge.
Right, and what that concept is really, well, there's two concepts that you're bringing up, and it's called disclosures, which you use that term, that's exactly what it is. But what it's meant to do is to provide transparency. And I noticed you did do that whenever I happened to be attending your lecture, if you remember. And I noticed that you did do that. And the only thing I would recommend as a little caveat to that is I would actually make it a slide in your presentation. And I'll be happy to share with you mine at the end of the presentation, but I always include a disclosure statement. And I divide mine up, and I would recommend you divide yours up into financial conflicts of interest and non-financial conflicts of interest. Because like I do a lot of volunteer work that there's no monetary value involved.
Yeah.
Actually, the work I do for the Massage Therapy Foundation is considered a non-financial conflict of interest. I've done, and I know you and I've worked on committees before that weren't really paid committees. We didn't receive financial reimbursement for it. They paid for expenses, but that's very different than monetary compensation.
Yep.
And those would be considered non-financial conflicts of interest. And even your professional associations that you're a member of. I am a member of AMTA and also the Alliance. So in my disclosure statements, I disclose those relationships as well. And then I have to disclose the fact that I do receive CE compensation. See, I don't receive any compensation for this tonight, so that would be a non-financial disclosure. But I do receive royalties for textbooks, obviously. Yeah. And I also teach at a massage school in Louisiana, so I put that on my financial list of possible conflicts of interest. So when you do it, or when I do it, that's just basically disclosure. So, and I think that really needs to be, and it's part of our professional responsibility.
And I find it interesting because every time I've lectured to non-massage therapy groups, so chiropractic or naturopathic, acupuncturists, I've lectured to them as well. And every time I do it in those other circuits, I have had a slide that is, here's who I am and here's my potential conflicts of interest. And it was written out. And I don't know why I haven't done that with my massage therapy teaching gigs, but thank you for pointing it out, because that is definitely something that I can improve on, something that really can connect us really more into the clinical field and kind of keep everything out on the forefront to make sure that everything is disclosed, both financial and non-financial, that are volunteer sides and just the rest of the pieces. What are some of the challenges that you can see if someone doesn't disclose their conflicts of interest?
Well, it could impair objectivity, and I want to go into a little of the non-financial conflicts of interest, because that's the one that's a little more vague. Do you mind?
Sure. Yeah, definitely.
Okay. Because I have a story behind one of them that I think is going to be kind of interesting. So some of the non-financial conflicts of interest, and I want to go back to them. I want to go back to the ones, but I'm kind of list them all out right now. One is called an academic conflict of interest. Okay. One is called a conflict of conscience. One is called a personal or a familiar conflict of interest. You got a big family, so that might be a trouble for you down the road. And conflicts of commitment. So let's talk about academic conflicts of interest first. And so what the problem with this one is, it may cause what's called a confirmation bias. This is one thing you have to be aware of in massage therapy is, so what I did was this is a great story. So when I was in Washington, I was visiting with some members, and I teach a lot with research. Uh-huh. And I ran across a study where it was a randomized controlled trial. Okay. And they looked at massage for lower back pain. Okay. And I've never seen this done before. It's fascinating. They did two types of massage. They did what they called a relaxation massage, like the kind that you get at a spa. Yep. And they did what they called structural massage. It wasn't the best word, but if you read the study, they described more as myofascial release, more trigger point work, more of a clinical based massage. Okay. And they compared outcomes. Yeah. And guess what happened?
They both got better at the same rate.
There were no significant difference. Okay. So anyway, so I put that up there, and the comments were so interesting. It was almost like no one wanted to believe it. It was a flawed study. How could relaxation massage have been the same improvement as a clinical massage? But that was a confirmation bias. Yep. Because the people who do clinical work, people who had invested money in clinical work, could not see the study for what it was, because they were skewed. I mean, I go into it kind of with a clean slate. I'm just curious about what the data showed. You know what I mean?
Yeah.
So I'm in there, hey, this is fascinating, so I like, it kind of levels the playing field a little bit. And so, but that's a great example of a confirmation bias. So you tend to discount studies that you don't agree with. You kind of devalue some things, or you overvalue other things. And so that was another kind of conflict. And massage therapists, we have to be really careful of being open to all good information, because we're going to make better decisions for our clients and for CEs whenever we realize that all massage has value. Now, one massage doesn't have more value than the other one. So to me, that was a fantastic study, but that's an example of academic conflict of interest or a confirmation bias.
I love that connection, because I actually have one that's very similar. I used to teach at the University of Western States in Portland, Oregon. I helped organize that and create that massage therapy program. And it was so much fun, and we were so excited. And when I started, they had a piece of research that they put together, and it was a large grant, and it was a lot of work, and a lot of finances went into it, a multi-million-dollar research, and it was about lower back pain. And they used the first group they received chiropractic adjustment.
Mm-hmm.
The second group got positional stabilization without the joint thrust adjustment.
Mm-hmm.
And the third group got massage therapy. And so we were being used as the null, just the other group. And I don't remember how long it went. I think it was a year. But they had these people come in and they had problems, and they were working on their lower back pain. And at the end of the year, they published their research, and it showed that all three groups got better at almost the same rate.
Wow.
And the chiropractic, because this is a chiropractic college, They were like, oh no, we took all this money and it doesn't show what we were hoping it to show. So they had gotten grants to publish this, and they had all this money into it. So they had to publish.
Oh, yes.
So they published it, and they never referred to it. Well, as opening a massage therapy program, as starting the massage therapy program, I'm like, ooh, this is great information. It just doesn't show exactly what you thought it was going to show. It shows that there's different aspects and different ways that we can come to. It was so much fun to kind of really poke the researchers at the college and kind of say, you did a great job, and thank you. And kind of go through that whole process of, it's good information if it supports us or not. Right.
But that is being objective, and that is a great example of what happens when you take your bias and you set it aside. And in research, as you know, there's all kinds of ways that you can reduce bias. And in research, they call it provisions for trustworthiness. And I know that I had to go through 3 steps when I did my study.
Mm-hmm.
And one's called an epizade, it's called bracketing or scaffolding, where you say what your biases are, so it's not kind of like disclosure.
Yeah.
And the second one that I used for my study was called member checks. And basically, you take your transcripts from your interviews and you give them back to the participants, and you said, is this what you said? That way, before you start analyzing the data, you got clean data to work with. Another thing that I did was called an external audit. And this is when you take your study and you don't analyze it, you let someone else who's not interested analyze it. So that creates objectivity. But another thing that I do, going back to conflicts of interest in my own academic bias, is when I'm having a chapter in the book reviewed, let's say pharmacology is a great example. I require 3 different reviewers to review the textbook or a chapter in the textbook. And those requirements are, and all this is managed, by the way, by a developmental editor, not me.
Good.
So I've got a massage therapist reviewing the materials. I have a massage educator reviewing the materials. And then again, with that whole concept of external audit, I have a non-massage therapist who's a specialist in the medical field that I'm dealing with. So in this case, a pharmacist review it.
Beautiful.
But this is how I prevent bias, because I would be biased to the pharmacist, right?
Yep.
So what I would do is, when they would come back to me, it's called single blind. They know who I am. They know it's Susan Salvo. but it's single blind, so they're not blinded to me. But when I get them back, they're blinded. So they're reviewer 1, 2, reviewer 2, reviewer 3. So there's no way for me to tell which one is the massage therapist, which one is the educator, and which one is the pharmacist, because it shouldn't matter who said what. What they say should matter, but not who said it. And I know if I knew it was the pharmacist versus the massage therapist, I would be more biased to the pharmacist. So that is another way that I reduce bias and I create more objectivity in my writing. So and there's so many ways to do it. Another example, let me go back and look at my list. Personal conflicts of interest you've already talked about that. This would be like my husband working on part of a book, or giving a job to you because I know you.
Yep.
That would be personal. I love this one too, the conflicts of commitment. And so recently I was asked to be on a national board. Mm-hmm. And when I really sat with myself and I thought about all the projects that I'm working on, and could I truly commit the time and the energy that that job required, I had to be honest with myself and honest with the board and say, it's not in the cards for me right now. But that's another example of really examining the conflicts of commitment and realizing that I'm unable to make a commitment at this time. So I think all of us have to deal with conflicts of interest. And again, so a couple things to think about. We talked about just transparency.
Yes.
What I did was I decided not to get involved in the project. But let me tell you what my husband does. My husband works for a chiropractor. He does clinical massage therapy.
Oh,
and
I didn't know your husband was a massage therapist.
Yes.
Oh, okay.
And so at his job, the employees get a bonus when they refer someone to the chiropractor.
Okay.
So that creates a conflict of interest for him.
Yep.
So what he decided to do is when he refers someone, he doesn't accept the payment. So he divests in himself from the financial situation. So that keeps him unbiased about chiropractors.
Yep.
But because he does believe in chiropractic. And so there's all kind of ways to manage it, but being blind to it is not the way to manage it.
No.
You must constantly self-reflect and decide, always act in the client's best interest. And again, disclosures are very important.
So I think that's a really important connection when I start looking at what insurance companies start saying about referring for financial gain and that kind of stuff. There's a real murky gray line there where chiropractors and massage therapists, I've seen payouts that really make you uncomfortable. And so if you don't look at it up front and say, wait a second, this could be a real problem in the future, and set your own standards, create a statement and live by it before someone else comes into the situation. I've been using the statement recently, humility can be self-imposed or inflicted. You choose. And I would much rather have self-imposed humility to say, wait a second, I really probably shouldn't take that. And maybe we should make another idea, and I should humble myself to say, you know what, I can't determine who should go to a chiropractor and who shouldn't. I can't determine who should go here or who should go there. Financially, it's an off-limits thing for me, and I can just put it out there to, you know what, you should go see your doctor and connect them with the person that may be best for them. It's a humility issue in my mind, but it also has that conflict potential that the insurance companies really don't like seeing.
And people like the AMTA or any organization that uses presenters, and you know this from because you're a presenter, there's always a conflict of interest statement. And another thing that they do is they make it real clear that it should not be, this is our next thing we'll be talking about, it should not be a form of advertisement. It should not be something that people are required to spend additional money to get. And you are not allowed to make, usually not allowed to make, I'm supposed to make personal recommendations. And I got busted on this one time. So this was kind of like the humility forced upon me. I made a recommendation for a very particular product in a class. And a person, and I'm really grateful for this, calmed me down on it.
Nice.
And I regretted that decision. But now, one of my favorite quotes is, "Experience is the best teacher," but you get the lesson, you get the test first, then the lesson.
Yeah.
So apparently I failed the test, but I learned the lesson. So I always, the magic number 3, I always reference 3 products or 3 types of lubricants or tables or whatever I'm talking about. That way I'm not looking like I have preferential treatment to just one company.
And I think it's important to show, just in research when you're teaching, to be able to know multiple different options. One that I know I fall through, and I think a lot of people do, when I'm talking about doing a search on the internet, I always say, do a Google search. And really, you could do a Bing search, you could do a Google search, you could do there's other search options out there. Why am I connecting just with that one brand?
Yes.
You grab a Kleenex instead of
facial tissue. Yeah.
Tissue. I mean, these are names and brands that we kind of have started to see our society really draw into. And it's really nice when, as the instructor, you can give multiple options and really inform them. So you actually started moving into this. So let's actually look at letter G, because that's a good transition for us to kind of go through. Let's see, letter G. Let me scroll down just a little. Standard 4G is advertise in a manner that is honest, dignified, accurate, and representative of services provided, and remain consistent with the NCB Code of Ethics and Standard of Practice. So I take this in a couple of different directions. One is as an instructor like you and I, and we start talking about, okay, how are we teaching and what are we saying when we're in the classroom? But then if we go the other direction and we start talking about how a massage therapist advertises their own practice, I've seen some abstract pieces of advertisement that would be considered borderline for massage therapy, where they're either not intentionally but almost unintentionally sexualizing massage therapy, just because they think it makes it look prettier or it makes it look more enticing, or they clinicalize massage therapy to a point where they're wearing lab coats and they're trying to show that we are massage therapists who are only clinical, where yet we still do specific things that are standard massage therapy. It's a challenge for a massage therapist to look at, okay, how do I define what I do? And then how do I define what I do? And then push that out to the public so that it's no longer a bias, but it is a issue of, I can understand what they're doing and it's not intended to give a false understanding in some direction. The other group that I will slap on the wrist once in a while are the sports massage therapists. Because if you're in, we went over this policy several weeks ago about advertising who you've worked on and that kind of stuff. And if you didn't get appropriate documentation that they have given you permission to say what it is that they exactly want you to say, that's a problem. But what is the
actually HIPAA violation?
It is. It's a HIPAA violation.
Yeah.
And it's dangerous in so many ways, but it also comes down here to just what are we advertising?
Yeah.
Are you advertising that, hey, look, I can work on really amazing athletes and I can work on your 12-year-old son who's in middle school track? It's an advertising piece that I'm not really comfortable with, and making sure that you're not misleading the public to what massage therapy is. So they specifically go into sexual provocative language. I have to say, when I look at my connections, and there's a bias there, right? Because they're the people that I know in massage therapy. I know other volunteers. I know other professionals. The ones that I hang out with aren't going to sexualize or create a provocative language towards massage therapy. Most of them are going to go the other direction and want to have it be openly very professional and making sure that people understand and can connect with what it is. The spa industry is its own game. It's its own piece. And I'm going to pat the back of the franchises who have really strived to not have things so sexualized and still have it be a clinical, what I call a blue collar spa, where
I like that.
More accessibility for every person, no matter what their job or their work, instead of the white collar where you've got the high end people only able to afford massage therapy. It's for everybody. And I'm going to keep going if I don't shut up here for a second, but I just got a review. So it's interesting to be the person that I am, because I get reviews on massage therapists that practice all across the country. And I got this really wonderful review about a massage therapist who just does a great job. And the whole thing came to me because we have flags that come up of any negative comments on a review would come to us, no matter if it was 5 stars or 1 star. And the word uncomfortable was in there. And uncomfortable is one thing that we want to make sure to flag. If someone feels uncomfortable, we have to see it.
Yeah.
But the statement said, I forced my husband to come in and he didn't feel uncomfortable at all. This massage therapist was great. And I'm so glad to hear that when something happens, it's never going to be at your spa, because you guys are the best. And it really made me go, okay, so it is one person, one massage therapist representing a group practice, no matter what business structure that looks like. And NCB is a business structure just as much as a franchise is a business structure. If you have one board certified massage therapist get slapped on the wrist for something, it makes the board certified standard have that same perspective. And it's really concerning if we're not taking care of making sure that we're policing ourselves. And so when we see an advertisement that may not be what we think it should be, if we think there's false advertising, as a board certified massage therapist, our responsibility isn't to call them up and say, that was the worst, you should never do that, that's horrible. But our responsibility is to send it to the National Certification Board. They have an office, they have a board, there is people there to take that information and to create a file and to say, okay, hold on. Now, we shouldn't tie ourselves to the end result. I usually see this when someone is concerned about a massage therapist who they think did something wrong, and so they report it to the state licensing board, and then they're seething because that person still is practicing, and I can't believe they're still practicing. If you did your job, that's the responsibility that you can deal with. You can't deal with it.
You can report, but you cannot investigate. You cannot control the investigation.
It's not yours to do. You have to connect with it, and you have to be responsible for you. And when we can do that as board certified massage therapists, and we can really make sure that we are self-policing instead of having external sources having to go out and do more research, we're going to be a stronger community, and we're going to be a stronger group. And then people will reach out to national certification and say, yeah, that's an important piece.
Absolutely.
So this to me also goes to branding. And so if you're looking at your advertisement, that's kind of the initial face that you're putting on a brand, right?
Yes.
Susan Salvo, you have a face that whenever I see it on a flyer, I kind of go, yep, that's Susan. And you are part of your brand. I see a lot of people who have like a picture that is, or a logo that is their brand kind of piece. When we look at the branding of massage therapy, I was a little shocked. This week, I actually went to the Google Trends website. So if you search Google Trends, it pops up a website, and you can search what the top search words were on Google for the last 12 hours, 24 hours, week, month, 2 months, 3 months, year, 5 years, and then all the way back to 2004. And I kind of went, well, I'm wondering what search terms would pop up. And so I just did a general search, and it gave me everything, and it was really kind of interesting. And then I started typing in things that were related to massage therapy. Licensed massage therapist, had a very small spattering. Massage therapy and bodywork. And I started putting in these terms. I put in the National Certification Board. I put in the American Massage Therapy Association. I put in the ABMP. ABMP is not coming to me. Associated Bodywork, ABMP. That's not going to help.
Associated Bodywork and Massage Professionals.
Thank you. Associated Bodywork and Massage Professionals. Every once in a while, it has to get caught up. And then I started looking at other terms that really have become buzzwords. Even namaste. I started looking up.
You have way too much time on your hands today.
Yeah. This was one of those, I got crazy 10 minutes and the kids are trying to go to sleep, so I'm going to sit down and do something. And it was really kind of interesting to see what terms have drawn and which ones have fallen off. Mm-hmm. And NCBTMB as a search term from 2004 to 2009 were fairly high. And ever since 2009, they had died off significantly.
So what happened in 2009?
I don't know.
That would be my question.
Exactly. And that's where then the research of history to kind of say, okay, so what's going on at these different points? And
I know what happened in 2009.
Emblex?
Yep, that's exactly. So it started in 2008, but it really took off in 2009. And
FSMTB and the Emblex both started, or Emblex really hit.
If you look at Emblex, all of a sudden you would see them diametrically opposed then.
And I mean, it was fun to me to kind of look at these things and then say, okay, so what is the general search audience looking at when they say massage therapy? And the search terms for what we would be looking for are completely different than what our customers are looking for.
So what'd you find? Tell me the end result.
The end result was when we looked at the terms that massage therapists would be looking at, they were like that. They had a similar cohesive understanding of what's new in the trending in the field. Even like cupping, I searched cupping massage, and it had nothing, and then it had the Olympics, and then it had nothing. Kinesiotaping.
Really?
Yeah, kinesiotaping had nothing, the Olympics, and then it had more, but not much anymore than it had during the Olympics.
Yeah, hence the word trends.
Yeah, and so it became this universal trend. So when we're looking at the terms that people are using for searching massage therapy, they're not searching for a licensed massage therapist. They're looking for massage for back pain.
Those are the key words.
Massage for headaches, that would go up. Massage for, and then any specific diagnosis, those all went up as you started looking at the different diagnoses because it has to be related to them. And so when we're looking at advertising, and we're looking at making sure that our advertisements, first of all, are in a understandable and good structured manner, we also want to make sure that they're appropriate to the client that we're looking for. So using search terms, so if you do any of your advertising on Google, you'd be looking at what it is that your clients would be looking for that affect them. So if you work with the foot, if you work with the knee, and you kind of find that as kind of something that you do a lot of and you've got specialty education in that, that would be where the strength is.
But hang on a second. Wait, this is interesting because what you said
Mhm.
was you said clients were searching based on conditions, not on body areas, correct?
So yes. So
So okay, well this is beautiful because what you're telling me is when you advertise, that's what therapists should be doing.
if they're doing Google advertising, they should be focusing on the condition and massage therapy
That's pretty brilliant.
instead of myofascial
Myofascial
release.
release or craniosacral
Point
therapy, or they're not looking for a modality.
No one knows, and no one cares. No one.
That's very, very interesting.
That's a whole different world that we start looking at, and we start saying, you know what, we want to have appropriate advertising that really strengthens our clients and draws them closer. Go ahead.
But this is going to tie into the whole concept about truth in advertising, because this is actually an easier hand to play with. Because when you make it condition specific,
yes,
you can look at the research and back it up with, we know massage does this or this and this. So then you've got the truth in advertising. You're making the clients easier to find you. But one thing I don't want to leave today without talking about is the whole concept of informed consent and medical clearance. I know we talked a tiny bit about that. Is now a good time to breach?
Yes, let's do it, because I've been trying to kind of figure out when to put this in, because there's a couple of pieces to this that make my stomach go and that's my ethical dilemma, because I always let me toss out my bias here. I would rather have a good relationship with the medical practitioners and know that I would refer their patients back to them if I had any concern about their condition.
Okay, this is where it gets really interesting.
Okay.
So about 8 years ago, I had met a lady at a conference, and she contacted me. She said, I have a problem and I don't know how to handle it. She said, I had a client that she listed about 5 different pathologies.
Okay.
And she said, so what I did was I found out the name of the physician. So I called a physician and I said, I need medical clearance. Well, the doctor would never get back with her. Hung up on her at one point. Didn't return a phone call at other points. There was like 3 different incidences where the therapist reached out to her. So the client said, I don't know what to do. What should I do? I said, I don't know, but let me find out. So the first thing that I did was there's a concept in research called triangulation. And basically, you always make decisions based on at least 2 other points of reference. And so like if I'm doing a definition on conflict of interest, don't you know, I didn't just look at 1 source, I looked at 2. And I didn't stop looking until I found 2 sources that were congruent. Are you with me?
Yes.
It's everyone should be doing triangulation in massage therapy. But anyway, so I contacted 3 different physicians and asked them the same question. I said, I have a client. If I called you up for medical clearance, why would you deny me medical clearance? And all 3 physicians said almost exactly the same thing. And they said, when I clear a massage for anybody, I am now in the chain of responsibility. I am now responsible for every decision, every technique, every mistake you make. So don't put me in that position. I'm not going to sign these forms anyway. So I'm thinking, well, what do therapists do? And this is what was echoed to me. We need to understand, massage therapists need to understand what they do well enough, both the true benefits and the risk. And this is where we mess up as massage therapists, is understanding the risks. And then informed consent. Then you disclose those risks and those benefits to the clients so the clients can make informed decisions whether or not to receive the therapy. So let's talk about risks for a second. We know that about 1% of the time, a client's going to have an adverse reaction to massage therapy.
Yep.
Adverse. And I won't go into this unless you want me to. You may not want me to go there. But
that's an hour itself.
Yeah.
Yeah.
But we have about 10%, I have the research to back this up. About 10% of massage clients do receive side effects, not adverse effects, not like serious adverse effects, but side effects such as increased discomfort, bruising, soreness, But in those 10% of cases, what the research says is that those symptoms don't start for about 12 hours, and they last maybe 36. And those minor discomforts do not affect activities done or at work or at home.
Okay.
So in your informed consent process, you must disclose all of these potential risks. Maybe the client doesn't want a deep pressure massage, and maybe they are going to feel a little sore the next day. You still have to disclose that information to them. Your treatments may be causing bruising, cupping, my gosh, hot stones. All these have risks. If you disclose those risks to the client, then they can make an informed decision. But withholding those risks is not good advertising.
No.
So you need to understand the therapy well enough to know when massage is appropriate, when massage is not appropriate. Like what happened in our conversation recently about dialysis. There's a lot of misinformation about massage. There's a lot of fear. Surgery is another one we could talk about. Oh my gosh, people don't know what to do with it. But we have research that says massage is being done in the post-op recovery rooms. So we should really be deciding when to give a massage and when not to give a massage based on back to evidence. We have a lot of evidence that massage is great for lower back pain, great for post-operative surgery, great for peripheral neuropathy, athletic soreness, all these things. But massage therapists need to be doing a better job keeping up with not only their modalities, but the research, both in the benefits and in the risks, and disclosing those to clients. And when there's something going on that really does deserve medical attention, to refer them back to the healthcare provider. There was this great study put out by the Mayo Clinic, 2018, brand new release. And I love the name of the study. They said acupuncturists and massage therapists, new allies in healthcare, because they're helping to expedite medical diagnosis because of the fact that we see clients disrobed on, appropriate areas clothed, but like their legs and stuff, that we have diagnosed lesions, cancers, DVT. And so sometimes we are on the first line of healthcare. And so all these things need to be taught more, they need to be discussed more. There needs to be open lines of communication with the client and with the client's healthcare provider. But medical clearance is a different animal, and that's we need to be real clear about the language that we're using. So we need to do a better job with understanding what it is that we do, both the limitations and the advantages of using massage therapy.
Now, with medical clearance, I have to toss out a different bug, because I know in so many times it has been put out that this is a clinical massage therapist and this is a spa relaxation massage therapist, and they don't know the same thing. Truth be said, I know some of the most clinical massage therapists work in a spa. Some of the most relaxation-based massage therapists work in a clinic. And so I can't agree that it's by their education, but I think in my mind, in my experience, when a person goes to a spa for a massage, the expectation of the client versus the expectation of a client going to a chiropractor's office or to a clinic or to, if they are just post-surgical and getting massage therapy in the hospital by a massage therapist, there's an expectation difference that the client has about what massage therapy is and what it can do. I'm not sure what we do with that as a profession.
I have an idea. Well, first of all, public safety is going to be important no matter where the massage occurs.
Correct.
Period, the end. And the interesting thing about it is that most massages are received in what setting?
Most massages are received in a spa.
Yes, that's correct.
Statistically.
Okay. So now what I like to do is I like to talk about back massage in two different domains. I like to talk about massage in healthcare, and I know this is a big hot topic right now. And I like to talk about massage in self-care, and they are different ends of the wellness spectrum. So healthcare massage, the way I define massage is soft tissue manipulation using compression and traction for either therapeutic, palliative, or self-care reasons. 3 things. So in a clinical setting, it's done for therapeutic purposes or palliative purposes. By medical definition, the medical definition of therapeutic, and I know we misuse this term all the time. It drives me crazy. But the word therapeutic means that it's curative and it's related to a disease or an injury, period. Palliative means there is still a disease or an injury, but it's not responding to curative measures. So it's still done for a disease or a condition, but it's non-curative. Self-care is wellness massage, is spa massage, is relaxation massage. Those are different animals. And yes, you can have a person who works in a clinic who's doing therapeutic massage, but like my husband does, he does chiropractic work where he's doing therapeutic massage, but he also has a private practice where he does self-care massage. Now, in that self-care setting or in that private practice setting, he may have therapeutic cases. Am I making sense?
Yeah.
Okay, but we as a profession need to be clear about when it's therapeutic massage, when it's palliative massage, and when it's given for self-care. And the rules really do change, Nathan, whether or not you're in each setting. So if you're in a true therapeutic setting, who sets the time limit on that?
So that should be by prescription and by per unit.
Right. So the third-party payer is deciding, usually it's going to be a 15-minute to 30-minute massage. How often you get a massage is also determined in the therapeutic setting by the third-party payer, and when that prescriptive period is over. Am I making sense?
Yeah.
Okay. In a self-care setting, the rules are totally different. In the self-care setting, which is where more jobs are, and I will also say, if you look at the AMTA research report, they also tend to make the most money in self-care massage, with exception, well, I won't go there. But anyway, who decides how long the session is and how often the client can go back in a self-care setting?
That's the client, yeah.
The client or the business who's ever setting up the menu of services. But something else that I found out too recently when I was working on my book, even the differences with informed consent at the age when an individual can grant consent changes. In a true therapeutic setting, because it's considered a medical intervention, it's usually 18 years old is when you can consent for yourself as a consentable adult.
Okay.
In a self-care setting, and again, I did triangulation to make sure I had this information correct. In a self-care setting, guess when a person can give consent, at what the youngest age is?
I would still say 18, as I'm connected in the spa industry as well.
Guess what the true answer is, according to the state boards?
I'm going to go by 16.
Bang, you're good. It's actually, okay, the average mean age is 16, but it does vary state to state, but it's determined by the age a new driver can receive a full driver's license.
Oh.
Yes, in fact, I called the state board triangulation to ask this question, and the girl said, of course, this is the South, one of the ladies I talked to, she goes, honey, if they can drive themselves to their appointment, they can get a massage at a spa. So again, so I think it's real important as we move forward in this profession to divide the massages up into healthcare versus self-care, because the rules are very different. So I don't know, that's just kind of my take on it. And I think it also may decide how we advertise, how we talk about our services. The type of massage won't really change that much. Am I making sense? Going back to that very first study we talked about.
Exactly.
You know, so I mean, it's not going to matter, but the setting does matter. As far as if it's HIPAA or not, if it's prescriptive or not, how often you go, how long you go. I mean, it's just a different animal. And I think that as we move forward in this profession, we need to have better definitions of these terms that we've been throwing around for far too many decades.
Yeah, well, and I have to toss this in. You have a fan on Facebook that is screaming bloody murder, saying, I love her, she's amazing. That's Donna Sarvello. Oh. She thinks you're amazing. Jennifer Cole is wondering what state boards, and I have to say it's probably all the state boards, and when you call multiple boards, you're going to get multiple answers depending on their state's legitimate pieces. So those are really important to kind of connect with. And I love the concept of triangulation, that massage therapists need to be able to connect with information in more than one way. I regularly get phone calls from spa owners in different states, and they're asking me, Nathan, can I do this or should I do that? And my answer is, I don't know. I can do some research. How about you do some research? And if you can get your manager to do some research, we'll come back together and we'll see if we agree. Yeah. Because to me, that's the easiest thing, because now you've got 3 different eyes looking at the same information to bring it back together, to then push forward to say, yes, we all agree. We're all looking at it. Yes, I may have more experience with massage therapy law, but that doesn't mean I have any great knowledge in how to read legalese. It's just that I have that experience in specific terminology. So yeah.
And all the stakeholders have got to be considered. And that's kind of when you talked about the way that you pull all these people together, that's kind of what we're talking about, but you've got to be able to see this from the client standpoint, from the business's standpoint, and from the therapist standpoint. Everyone has to be considered when you're making a decision. Well,
and I think there's a challenge for massage therapists who are wearing a business owner's hat. They're wearing the massage therapist hat. They're wearing sometimes they're wearing the client's hat if they're employing other massage therapists and getting massage in their own clinic. And now they're having a hard time separating themselves out in those roles, that being able to separate those out and have different brains being able to work on it in different directions is so helpful. So wonderful.
Well, even the Institute of Medicine said when you have a conflict that you cannot see, that's when you need to bring in an objective person to kind of say, okay, help me think about this. Something's wrong here. Or having a mentor.
Peer mentoring is so nice to have someone that you can pick their brain. I do have to say that the reason why a lot of this conversation came up is because I had a spa owner who asked about if they're on dialysis, on kidney dialysis. And I started looking at the 2 people that I would be able to, the 2 people who I consider my mentors. Okay, and they will both happen to have written pathology books, and so I texted both of you, and I got different answers, which I love. I love that I have people who have different brains, who work different ways, who can put different things in my mind and kind of give me different pieces. The kidney dialysis I'm still working on in my brain to kind of figure out, how do we make sure that the client is safe if their kidneys are not functioning and they're going through dialysis? A massage is going to increase circulation to a regular exercise, so it would be a standard circulation improvement. It wouldn't increase.
The problem with the whole circulation conversation is massage doesn't have the circulatory effects that we thought.
I want to see your research on that one.
Okay.
No, let's.
Okay. There's been a study. Oh, this is going to be interesting conversations, Nathan. They did a study where they wondered if massage really did affect systemic circulation, and they put a Doppler in the femoral artery, and they gave a massage over the area, and the circulation to the artery did not change. It only has local circulatory effects. So a lot of the arguments against massaging because of circulation are not founded on evidence. Am I making sense?
Yeah, I want to see that research because that's exciting.
Oh, it is exciting. I mean, so once you take away the whole thing about massage really doesn't affect systemic circulation, then you see why we're doing people during dialysis. Am I making sense?
Yeah.
So, because the doctor's saying really doesn't have an effect. So going back to, we have to make decisions based on research. Well, there's one other thing I wanted to say. Ding, 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 ding. Oh, my mind just went.
That whole
but anyway, so I know what I was going to say. There is one of my mentors is Jane Buckle. She was a UK critical care nurse who wanted to give massage to people who were in a medically fragile condition, such as dialysis, such as hospice.
Mm-hmm.
And she came up with something called the M technique. M stands for manual. So basically she says that you can give a massage to anyone when you give it with 3. If you have a pressure scale from 1 to 10, the pressure should be a 3. The speed should be a 3. And the sequence should be a 3. And I actually have a video on it on YouTube on the M technique. And when I was giving a massage at a national convention on massage for the medically fragile, there are massages you can do where deep pressure is not always beneficial, but that doesn't mean they cannot receive a massage. Am I making sense?
So, I do the same thing. I think the same way. I think every person, no matter how fragile their body is, massage is not, as a category, is not contraindicated. Certain techniques.
There's very few absolute contraindications.
Absolutely.
Very few.
And the few that are out there aren't going to be walking into a spa. They're going to be in a severe state where you're not going to be helping them. So I agree that massage isn't contraindicated for 99.99% of the things. There's local contraindications that massage therapists need to be conscious of. They need to be thinking about, how is this going to help, or as you said, hurt my client? What is it that I'm going to change in my treatment plan for this client that's going to help their condition improve, or that I need to take away so it doesn't cause any trauma or dysfunction to go through their body? I'm hoping and I wish that more massage therapists would look at their treatment plan with that assessment instead of the assessment of, okay, well, I'm going to go through my standard regular routine.
Oh yeah. Well, but that just means they need more tools in their toolkit.
Correct.
And I will tell you, the M technique is so easy to learn. It's so intuitive. But I think that, now keep in mind, this could be a problem, and this actually happened to a massage therapist that I know about. They did not give a massage. The person had a disability. The person sued the therapist for, what's the word I'm looking for? Help me out here.
Discrimination.
Thank you. And won. So I think therapists have to really make decisions based on, why am I not giving them this massage?
So
is there really evidence that says it's going to be harmful? Because of the whole thing about pregnancy, or cancer, or alcohol. I mean, we have a conversation about alcohol or what's the other one? Painkillers.
Yeah.
I mean, people are making, and when I was in Washington with you teaching, one of my favorite moments was we were talking about a person being on muscle relaxers and what you should and shouldn't do. And when I was kind of challenging some of the things people were saying, I'm going, why do you say this? I mean, where's it coming from? I said, show me one piece of evidence that says you're really going to hurt this person. 10% chance that they will get bruised and sore, but they're taking painkillers. It's for generalized desensitization anyway. They're not going to be sore. So, and they need the massage. Clearly, it's for muscle aches and pains, right?
Yep.
That are non-specific. And then I looked at the class and I went, what's lacking in this profession is a framework with what to think. And then I started talking about Patricia Brenner's novice to expert theory. Have you ever heard about that?
Yes.
It's a lovely theory. So I talked about that when a person is a novice, fresh out of school, they're more rule-driven, do's and don'ts. But when you become more proficient and become an expert, and it only takes about 4 or 5 years of continuous practice, then you become more principle-driven. Am I making sense?
Oh, yeah.
Okay, so what my job is as a presenter is I'm going to give you a framework from which to think. And I do kind of blame educators, because some educators are like do's and don'ts. No, you have to think about a framework. You know, what are the true risks? What is the intake? What are the benefits? How much time do I have? What is my skill? Going back to representing your qualifications honestly.
Yeah.
I don't do manual lymphatic drainage. I can usually tell when it's indicated, and I refer them out.
Yeah. And knowing what you don't do and knowing what you do is one of those big defining factors that comes with enough experience to know what you can and cannot do and what other people are better at.
But we have to get therapists looking more at the research, and it's there. That's kind of what I've been spending the last 3 years of my profession doing, which is what I sent you the other day when I sent you the dialysis blog.
And I loved it.
That it's like, okay, guys, someone needs to be able to take all this data and synthesize it into some easily readable form to say, oh, this is what I need to know. And you could print it out and give it to the doctor, or print it out and give it to the client. And if they want to go look at the studies themselves, you've got the references. And I encourage them to please look at the studies. They're fascinating. But to me, that's my overarching message for the listeners tonight is, get excited about research. We need to base our decisions on evidence, and we just need to give them tools to how to do it, which is what we're doing in massage school, which is what we're doing in C classes now.
Yep. And Susan, thank you so much for joining me this evening. It's been a joy.
My pleasure.
I just want to quickly recap, go back over the two topics that we generalized over and then got into all the other fun things that we had to talk about, but they all wrap around. Standard 4F is promote his or her business with integrity and avoid is that right? Yes, avoid potential and clinical conflicts of interest. And then advertising in a manner that is honest, dignified, accurate, and representative of services provided, and remain constant with the NCB Code of Ethics and Standard of Practice.
And based on evidence.
And based on evidence. Susan, I'm going to ask you to do one thing. The Facebook Live video is on the page. There's a bunch of questions for you on there, Susan. So if you would go to my page and then just go to our video and start looking at the questions that they're going to come up. I'm going to go on and look at several of them and toss in my 2 cents, but I know there's some that you'd be much better at answering and kind of connecting with. Our friends would appreciate it. But I want to say thank you, to you for joining me. Thank you for those on Facebook Live who joined us, and for those of us who clicked on this YouTube video and are trying to get continuing education for it. We appreciate you coming and joining us. We really do hope you pulled something out and really got excited about research and the importance of making sure to focus your own skill to make sure that you know what you do and how you can advertise yourself appropriately. Thanks, guys. Have a great day.
Thank you, Nathan.
Bye-bye.
The hour has flown by. Susan Salvo. We hope you've enjoyed this discussion with Ethics Outside the Box. As you've seen, Nathan uses many second-hand stories of ethical situations. If you'd like to share your story or you have any questions, feel free to contact him at nathan@educatedtouch.com. If you have just watched this video and would like continuing education for home study, you can go to shop.educatedtouch.com under the home study options with the date or episode number to receive your exam. If you would please like this video and subscribe to our YouTube channel, we will keep you up to date on new videos. If you'd like to attend one of our live courses, you can find upcoming scheduled events at www.educatedtouch.com. Thank you for joining us today.